The data shows that vaccines are safe and effective. They reduce the number of hospitalisations and deaths. They protect the vulnerable. But still, there are many people who don't want to take the COVID vaccine. Even medical workers at the front line of the battle against the coronavirus. Where's the skepticism come from?
The information war. Experts say anti-vaxxers are better at spreading fear than the mainstream media is at spreading the news. But many nurses and doctors are reluctant to go get the jab. In Belgium, the vaccination drive has been delayed due to logistical problems. And then there's the skepticism about vaccines, which is especially high among the French-speaking population. DW's Georg Mattes reports.
This is a moment to remember. A colleague photographs care home worker Cristina Rodriguez as she receives her second dose of the BioNTech Pfizer vaccine.
I really hope to encourage my colleagues, but also my family, even the country, to come and get vaccinated.
As vaccination drives in nursing homes like this one in the French-speaking part of Belgium draw to a close, many staff are still opting out. Almost half of all care workers in private institutions alone in the region are hesitating. Even the director of this home is among them.
What are the side effects, let's say in 20 years? Nobody knows today. So it's a bit like buying a car. You feel like you could be safe, but I want to see the crash test results. So personally, I am a bit skeptical. But for the older people, clearly, it's a good thing.
This caregiver is also unsure. He prefers to wait because he's heard some rumors.
I heard there are some products in it that can be used to... People can be observed from distance because of those products in them. Like espionage kind of stuff, you know.
And this is just the tip of the iceberg. False claims that the vaccine causes infertility or even death are spreading like wildfire across social media. The French-speaking part of Belgium appears particularly receptive to these ideas. The head of Nursing Home Federation, Fermabel, thinks making vaccinations mandatory may be the only option. So far, training sessions or online campaigns have failed to convince staff.
I did not understand. I do not understand. It was so hard for them. They saw a lot of elderly people who died. They saw the loss of life. And it's unbelievable how those people do not understand that they can protect themselves. It's a big question.
Vas-y, viens un peu mou, mou, mou. Mou, mou, mou. Voilà, tchac.
Back at the nursing home, this local doctor is trying his utmost to demonstrate that vaccines are safe.
And that's why I tell the staff here, you need to get vaccinated. Not 70% of you, but 100% of you. All of you, in order to win this fight.
Many of Cristina Rodriguez's colleagues are also taking to social media to encourage others. She hopes each photo will make a difference.
Howard Catton is Chief Executive Officer of the International Council of Nurses. Howard, I know enough people, I've got enough neighbours and enough family and friends who are very sceptical about this whole crisis and everything involved on every level. But health professionals?
So we are strongly recommending that healthcare professionals take the vaccine. We have seen infection rates amongst nurses and health workers at a high level. Tragically, we've seen nurses around the world and other health workers who've succumbed to coronavirus. This is an issue about their protection and their safety, but also our health systems. We have no healthcare workers. We have no health systems. So strongly recommending that people take this. But for those who have questions and are hesitant, it's important to have the discussion with them and to understand the reasons for that.
Is it really about their health and not protecting our health? They're the ones doing the service to the community.
I think if you unpick the questions that people have, there's firstly things around this seems to have been developed very, very quickly. The vaccines come forward in a matter of months. That's true, but that's because there's been this great global effort to develop the vaccines. And you look at the processes, the steps that have been gone through by the medical regulatory authorities, they have all been followed. So we need to explain that to people so they're sure of that. Some people are worried about side effects. Look, there are 200 million people around the world who've had this vaccine to date, and the side effects that were in the trials are the same ones that we're seeing. So there's no undue cause for concern there. There's some frankly crazy stuff as well about people think they're being implanted with trackers that are going to monitor their movements. Well, if you're worried about that, you probably shouldn't have a mobile phone. But the key here is to talk to people and explain the facts and the reality so that they do have the vaccine.
Howard, at the end of the day, these doctors, nurses and other healthcare workers are the guinea pigs. They're first in line to get the vaccine. So I can understand to a certain extent this anxiousness.
Some people have genuine questions about the speed with which the vaccines have been developed, or if there are going to be side effects. Some people also are younger and are saying, well, it won't affect us. But I think what we have to get here, that this is an individual choice that people can make for the common good. I think actually it's an act of humanity. It's probably the easiest way to save a life by having the vaccine, because you do not know whether you may, even in an asymptomatic way, pass on the virus to somebody else. You're protecting yourself, you're protecting our health systems, you're protecting the most vulnerable people as well. And when you explain the facts to people, I'm sure that overwhelmingly they will take the vaccine.
Howard, could you explain the facts for us when it comes to the AstraZeneca vaccine? Because that's the one that's really got people skeptical.
As I understand it, the trials that have been done do show that there is great effectiveness for people with severe disease and with hospitalisations as well. Listen, that's hugely important, that we stop people dying and we stop people requiring and needing really intensive hospital care as well. None of us can afford for our health systems to be overwhelmed. I think there's still work and trials that are being done on the effective in relation to milder diseases and moderate diseases. But I say the benefits in terms of severe disease and the impact on not just people's lives, but hospitalisations is really important, and why people should take the vaccine.
What about that data? Early data shows from 28 to 34 days after the first shot, the AstraZeneca vaccine reduced the risk of hospitalization by 94%.
This is data which is just emerging in recent days. It's stunning. It's beyond what people thought was possible a year ago. Experts were talking about perhaps 50, 60% efficacy. So the efficacy here is hugely important and should be reassuring to people. Millions of people are having the vaccine around the world as well, which gives reassurance around the lack of any severe side effects. But also, I think we've got an issue about ensuring that vaccines are available equitably right the way around the world. So far, the overwhelming majority of vaccines have been delivered in high-income countries. If we continue down that road, the risk is that new variants that might evade the vaccine will develop in lower-income, middle-income countries. And none of us are out of this until we are all vaccinated from the virus. The world is intimately intertwined. We don't win this on a nation-by-nation basis. We defeat the virus as one world.
You heard from Howard Catton, Chief Executive Officer of the International Council of Nurses. Thank you. Time for Derek Williams. Here's our science guy with another one of your questions on the coronavirus.
If we can't develop long-term immunity against a pathogen through natural infection, how can we do it with a vaccine?
We don't yet know how long vaccine-induced immunity will last with COVID-19, but this is an interesting topic to discuss anyway. As with some pathogens, you really can achieve longer-term effects with vaccines than through natural infection. That's because when faced with a pathogen, or in the case of a vaccine, a facsimile of it, the immune system responds with a cascade of events that eventually wipes it out, but also prepares for the eventuality that the pathogen could show up again someday. If that happens, the invader can be cleared out fast. As a rule of thumb, more severe disease appears to trigger a more lasting response. And we've learned something cool in over 200 years of experimenting with vaccines, which is that severe disease can be faked. And we can even tune the body's response to some extent. We've gotten pretty good at doing that effectively in a dose or two of harmless vaccine. Some people think somehow that immunity acquired from actually having the disease is somehow better than that you get from vaccines. But there are two reasons why vaccine-acquired immunity is actually preferable. First, of course, is that infection with any pathogen can always go badly, even in people who are otherwise healthy. So if you have the opportunity to protect yourself from that risk, you should take it. Second, as counterintuitive as it might seem at first glance, because they can provoke a more intense immune response by faking severe disease, the longer-term protection vaccines provide could actually be more effective than that prompted by getting the sickness itself, especially if you had a mild case, as so many people do with COVID-19. That's why healthcare authorities are recommending that you still get vaccinated even if you've had and recovered from the disease.